2023. At this time, Wayne is excused, everyone else is here. And the first thing would be approval of the minutes from February.
January.
Well, we don't have January's.
Yeah, we do.
Yeah,
Do
we
we-
can do January's under unfinished
Oh, where's January's?
business.
January's.
Yeah, we do.
Yeah,
Do
we
we-
can do January's under unfinished
Oh, where's January's?
business.
It's part of the minutes packet. It's the second page, or first page. It's
Oh, the new packet. Okay.
January 9th.
I didn't print that out. Here we go. Okay, so yeah, let's actually do January 9th first. Here we go.
I'm looking at.
That's your code of conduct.
Yes, the
Oh,
other sheet.
This is the agenda, and then behind it
I'm
is the
sorry.
minutes, no problem.
oh, yes.
Move to approve the
There it
minutes
is.
from the January 9th Board of Health.
Okay, do we have a second?
Second.
Okay, any discussion? Hearing no discussion, all in favor?
Aye.
Okay, then we're gonna move to approve the minutes for Monday, February 13th, 2023.
So move.
Okay, Amy was excused on that one. So, do we have a second?
Second.
Okay, any discussion? Hearing none, all in favor?
Aye.
All opposed? Okay, so the minutes for January and for February have now been approved. We are then going to go right to citizen comment period. There is no citizens report and the health improvement plan.
Yes, so to carry on the conversation from the Community Health Improvement Plan, as a reminder, this is coming out of the Community Health Assessment that the Franklin Health Department completed in 2022. So our next meeting is coming up on the 11th of April, so to come together and really set a collective vision and mission for the group. They've set the overarching goals to focus on, a reminder that that is focused on physical activity and mental health, and then also has an overarching umbrella of focusing on initiatives with community connectedness. So how can we pull the community? It'll take place in about a month. So before then, we're getting together a small group of individuals, more of a core team from that larger group, to have individual discussions about what they see as the value and the vision and mission for that group before we meet as a whole. So those invitations will be going out shortly, and we're excited for that. And then soon to come is the wrap up of that community health improvement plan. So putting it all on paper of what the group at large is looking to do, and then how we plan to do it.
Any questions?
It was a good group meeting.
It's a very robust group of community partners. So always inviting new attendees to the table. So anyone can refer someone else in, and we're always welcoming to more partners. Really, it's a collective to advance health in Franklin. So if someone's organizational mission aligns with that, and they're looking to volunteer their time towards that, we're having them at the table.
Who new has joined up recently?
I don't know that really anyone new has joined since it started coming together just recently in the past year, but one of the individuals from Polonia started
good.
coming
Okay.
and
good. Okay.
she is a retired nurse who's now coming to the table as also a board member.
Okay.
So that's a new development in the last cycle of people, but no one really knew because we're all kind of new.
Okay.
But hopefully even more to come for the next community partner meetings. We do always or email communications of who else do you think needs to be involved, who are we missing, who's not at the table, because we really want it to be a collective voice for the community health improvement plan is what we're talking about. So to be determined.
Great. Okay, then we'll move on to the time tap scheduling approval.
Excited to say thank you all for recommending this forward to the council. It did get approved, so now the City of Franklin Health Department will be able to put up scheduling for our services online. So we'll be utilizing that time tap system. Hopefully we'll be doing walk run as well. So we're still trying to figure out if financially that would work to be able to accept payments and then deposit it for the City of Franklin. There is a very an affordable cost associated with the walk run, mainly so that we can get commitment for people. So we want it to be affordable, and then there's commitment for people. So we want it to be affordable, and then there's opportunity to try to help sponsor people who may not be able to afford it. But that is one piece of the puzzle that we're still working out with TimeTap, is if we'll be able to accept payment. But we for sure can schedule things like car seats, and individuals coming in for blood pressure checks, different programming here,
Okay.
and it'll open up a lot of fun opportunities for us.
Great.
Will that be in the next newsletter or kind of an announcement?
That's a great idea. Hopefully it's up and running, and then we can put it in there. I like that idea. Thank you.
Just to let people know what kind of things they can schedule.
Right.
That's a good
What
idea.
kind of-
And then we're also, I think we mentioned this at the last meeting, but housing volunteer opportunities on there is an aim of ours. So if we have a Volition Franklin opportunity coming up, or if individuals can volunteer as members of the community for the 2-mile walk run, that'll be on there, and then they can slot themselves in wherever they'd like, so that they can always keep an eye on what's happening, through the health department.
Okay, and then finally, we do have an addition, .15 position.
We do unpaid. Well, I shouldn't say that. It's will be a grant-funded position for an intern. So it's very valued, the opportunity to be able to offer compensation for the expertise that students bring us and the value add that they have to our department. So step one to that of being able to pay an intern was getting them added as an authorized position, or getting added as a position in our authorized staffing table. So that went to council on the 7th, and we have grant funding and a student interest to fill it. I've been in communications with Medical College, Zilber, UW Eau Claire's Environmental Health Program, and UW La Crosse, who has a public health program. We just put feelers out there, but how many hours their students typically need for an internship, if they're typically paid or unpaid, and then when they're looking to slot students in. So hopefully we'll have some really great opportunities in the future.
Good.
Does that work out to be like 6 hours a week then? Is that how you schedule
It really
or
depends on
12
how the
in 2
student.
weeks?
Usually it's about 120 or 240 hours, and then that really depends on the school, student schedule, and then what we're looking for. So they can divide that up among their whole semester. However, it's mutually beneficial.
And then did you already exceed the time you could have allocated for an AHAC intern?
What do you mean exceeded the time?
So I know you can only do like 3 years. You can do a contract with AHAC.
I didn't realize that there was a time limit, but we haven't, because our very first year ever, COVID happened, and we didn't have a placement because the student wasn't able to come on site.
Got it, okay.
The second year, which was our first year, we had a spectacular intern who was John, and he helped do the Franklin Food Drive, make the golden can, and do things like that. So now we're planning, we did write in for an AHEC intern, which is in healthcare.
Yeah.
For the summer. So we said we would take, you can decide what kind of student placement would be best for your organization. And we said that we could take 1 full-time student or 2 part-time students, because just by happenstance, when we had our AHEC intern John on site last year, we also had a student from another university who was looking to have volunteer hours. So they worked collaboratively on the Music in the Park concert education series we were putting on, and it was really neat to have them to be able to bounce ideas off of each other. So we thought once we'll do 2 part-time.
Oh, super.
So hopefully we'll have one this summer.
Great. Okay, any other questions or comments on the administrative report? Now we'll go right to the health department general updates and communicable disease referrals.
Henry and I have been working together to shore up a reporting process to try to get the most valuable information into these meetings. There's a service called ServNet that the city of Milwaukee uses that they can
Can I
track.
pass this around?
Yeah, sure. We printed off a version just to check it out tonight, but it's different diseases and illnesses in the city of Milwaukee, and it pulls trend data. We can do that here locally with our systems as well, but if you recall, The problem that we're running into is some of the numbers are so low that it's not able to be reported forward-facing in this open meeting format. So toying, we were going to do that if we're lumping it into an other category or how we want that to look. So we're constantly developing this, and we'll get a product to you guys that can be reported on. But until then, I will let you know that we had 89 COVID-19 cases in the last month that we've followed up on, 16 STIs, and then 4 within that other category. Also, just a note, last meeting that we talked about, I didn't bring forward the numbers for House of Corrections because, as I stated, we're not the ones who directly follow up on that. It does fall into Franklin numbers, as we discussed, or House of Corrections typically. But for our gonorrhea cases, 50% were House of Corrections, 50% were City of Franklin over the last month. And chlamydia, 90% were House of Corrections, 10% were City of Franklin. And then all of our hepatitis C cases were House of Corrections. So that gives you a little, of our hepatitis C cases were House of Corrections. So that gives you a little idea of the breakdown. Henry mentioned that a barrier of sorts when the data used to be reported out in these Board of Health meetings in that ServNet format is, for example, you might get 100 cases of gonorrhea reported out, but identify via that report if it was City of Franklin residents or House of Corrections residents.
We just would go with the assumption that most of them were House of Corrections.
Because we used to get a locally made report.
We were,
as you-
that's what we're working,
Yeah, and then we're looking to
yeah.
and then we're looking to evolve a report forward-facing about Franklin services. So having a constant house number of the rabies or dog bite cases that we're working on, lead cases. So we do lead investigation through the health department. So if we were to get a certain value read on a child lead test, we would go out and do an investigation so we can track those human health hazards, social service referrals, which we informally discuss, but a table format will provide a little bit more clarity.
And we can compare it then month by month, see
Yeah.
if there's any peaks.
Because I'm assuming you're up on a computer system.
Yes, and we have this all internally already, so it'll be no issue.
But I would assume you could print out a report.
Yes, but it's very large, so a user-friendly report for this format will look
okay.
more like this. I'll create something like
Yeah,
this that
okay.
can come out to you guys versus tables and tables versus tables and tables.
What about the sanitarium? And going, when they do the food checks and everything, is that?
Number of licensed establishments that we do our
And if
regular
there's
visits
any-
to.
What, if there's any violations?
Yeah, we'll bring those forward under the environmental health report, but we can put that on the. That sounds good. And then let me just ensure that I touched it all. Yes, so we are good in that regard.
Okay. Is there anything you notice on that you,
Because of bacterial meningitis.
this is in the
This
county,
is-
Milwaukee County?
Yeah.
Oh my God, I thought this was in Franklin.
No,
I was like,
we're working on getting
These
fixed.
numbers will be high, man.
oof.
But many years ago when like pertussis was live, I mean it'd be like 5 the year before, 400 something, you know,
Yeah.
and all of a sudden it's like something jumps out at you and all of a sudden it's like something jumps out at you what's going on here. So that's something that we can then discuss, yeah.
So this is a sample from Milwaukee because they have the ServNet portal. We were discussing before the meeting. I don't know if Bill had a relationship with them that he could then have
Oh,
Franklin
maybe he
run.
did because I do remember seeing reports similar to this.
So we're investigating that.
That was just Franklin.
yeah,
And it was
yeah.
almost exact same thing.
But and I think that's where we picked up that the numbers were including the House of Correction.
He couldn't exclude that somewhere,
Right.
right? Yes.
And I can pull that data separate, but then the issue is some of these being such small numbers, we are able to include.
What you would have to do then if you did it that route is if the numbers jumped out, it's like, what's going on here? You'd have to say, but most of these are from House of Correction, you know, Falls Lake.
More of a narrative, yeah.
Right, exactly. Just to let the board know.
Sounds great.
Okay, if there's nothing else,
No active human health hazards or cases other than the 2 that we talked about that we're closing up as of last time. So.
okay. And then community health programming. We'll go first with the summary of Franklin's Health Department and senior dining program.
Yes, so we talked about department staff were going to present at the senior dining program on the 1st of March. So that first week of the month that the seniors meet at Root River. And I wanted to bring it back as a summary because it was really exciting to hear that the group had 125 attendees
Wow.
at their lunch this month, and they have 150 people on their roster. Their lunch this month, and they have 150 people on their roster. So I thought that was really important and worth noting. So a really great avenue for community connection there. Carol and Ellen presented on the health department programming, so stand up and move more and stepping on, and then some of the other ways they went through volunteering, getting blood pressure checks, just calling if they needed advice or a connection to a local resource. So that was really wonderful that they had us there.
Does Franklin have a buddy system for like
That's interesting that you say that because I was a part of the group when they were reforming, and we created these mini task forces of sorts. So we had a transportation work group that would help pair people with rides, and that was a thing that was brought up that another community did, and is this maybe what you mean, where you would call?
just to right,
Yeah,
yes.
yeah. So they did it. The other community that we talked to was they would have an individual that would come into the fire department weekly and just make calls to seniors to say, hey, how are you doing?
Right.
And that spurred this conversation on among these Franklin seniors of how they would do like a welcome onboarding. I don't think that anything ever came of it. That wasn't a stat when someone comes into the fold of like an official orientation, but I do know it was talked about.
Okay.
Alderman Barber, do you know any more about that if the senior group is doing that?
Not that I'm aware of. I've not heard that in the meetings I've been to, that
Yeah.
there's anybody doing that.
But they clearly are doing it right because they have 150 people there. So clearly are doing it right because they have 150 people there.
And
So
125
hopefully,
showed up.
yeah.
It's a good group. I mean, it's seniors and it's a good group. They're a lot of people come and then they have these presentations which they sit through. I mean, it's a place where people can go for lunch, so it's a social function. But you know, anything that they have good ideas.
And there's crossing of different groups there too, because then the senior walking club leadership and members are there. The travel club is there and presents and invites. The travel club is there and presents and invites people on different things and different events that they organize. So it's a good avenue. Meet people.
Okay. And then now.
Oh, sorry, one more thing to add.
Oh, yes.
We also closed up the senior lunch program with doing a paper survey of a senior prom because we heard individuals mention that they wanted to get physically active with their senior peers, and that had come together kind of as an offshoot of the Community Health Improvement Plan group. So we thought, well, let's collect some data and figure out where we want to go with this. And surprisingly, after all of the anecdotal information we heard, numbers were low to vote that forward. So we don't know if there wasn't enough information or maybe not enough details, but the interest level wasn't there. So we will continue back to the brainstorming table and not do a senior prom at this time, but just wanted to give you guys that update.
Okay. No other comments. We're going to move into the spring walk run.
The Spring Walk Run for this year is coming up on May 20th. As you guys may remember, the senior walk run or spring walk helped put on by Fit Franklin, the community coalition that focuses on physical activity. That group has been in a bit of a holding pattern since COVID and then some turnover in people's positions. So we do have 4 individuals who are a part of that group that will be worked into the fold for the planning team, but it will be primarily led by the Franklin Health Department and then Volition Franklin and then other community members who want to have input on that. But this year, we're still looking to do a 2-mile walk run instead of a 5K based on we'll go the same path or very similar path in Lion Legends Park. So through the community and then down the trail and then end over by the fire station. last year we had about 100 people register and complete it, which was a good number. With the YMCA led a toddler dash, and we had for you how we make it more of an event, like a wellness event or morning versus just a one event being the walk run. So this year, Franklin Health Department staff have been figuring out how to work in the 8 dimensions of wellness, and we believe the direction that it'll be headed is having a wellness day, like a Franklin Wellness Day on May 20th. And you can do the walk run as an event, there'll be yoga as an event, and then there'll be these 8-dimensional wellness tables set up. So different representation from the Franklin community that represent emotional, wellness, spiritual, environmental, financial, etc. So we're building those about 2 to 3 partners deep for each of those categories, and then hopefully we'll have a really robust turnout, which will in turn seem to be more of a health fair kind of in the field. So if you guys
talk to the senior walk group on it.
they're on the list, because we also these are my notes, we would also like to have cheering stations set up. So trying to figure out if there's maybe senior living facilities that have access to a van that want to come and park along the route and be the cheering section, or want to come participate in some cheering section, or want to come participate in some regard. But we do have the senior walking club listed under the physical for dimensions of wellness. Just some other ones that we have on there are the Conservancy, Rogers for mental health, possibly a support dog, environmental, we have Parks Commission or Milwaukee County Parks, Ware Nature Center, and these are all
Freddie.
our like wide casting of a net, and then we'll see who is available and able to offer their time. So that is in the works right now.
Okay.
Is there anything that you guys would like to see at an event like that you think would make it successful, or as a Franklin resident would draw you to a community wellness event or a walk run?
Will you have speakers?
Speakers that play music, or people
No,
speaking?
People speaking.
As of right now, we don't have that planned, with the exception of there is the Harley Davidson family created the Yell and Tell program. It's a program that focuses on safety because they lost a family member in quite tragic of an accident. Kids were playing and one became in distress in water, and the other kids that they were with didn't know what to do. So they created this series that's called Yell and Tell, and it's these books that can be placed in the library. And they asked us in the library how they could bring this to Franklin, and versus just putting it on the shelves of the library, us and the library director and library staff wanted to do more of a launch and really advertise it to the Franklin community. So we offered that they could have one of these resource tables in the Dimensions of Wellness, but then also have their mascot screen of one of the books that will be in this backpack that kids and parents can check out at the library. So that will be a speaker of
Sure,
sorts, but we
excellent.
don't have a structured speaker
Okay.
standing up in front of the crowd at all. Do you feel that would be a strength?
Depends on the topic, I guess. You know, vaccinations could be a topic.
Strength?
Depends on the topic, I guess. You know, vaccinations could be a topic. Things the health department does.
Yeah, we do want to have, for sure, want to have a health department table, so we can brainstorm some ideas of what might be a strength for that. And then we also want Franklin to get involved with their local government and how can you learn more about local government. So we didn't know if we could have maybe a meet the mayor table and kids could come and
Or I
meet
could see
whoever the
Steve
mayor
loving that,
is. Or they could, have you ever seen those pin maps that you go on vacation and it says, where are you from? And we thought maybe we could have the alder people rally their constituents to come to the wellness day, and then everyone can pin what district of Franklin they're from, so we can see what district turned out the most. Just trying to figure out how we can really draw from all parts of Franklin to come together in a fun community way.
Sure.
Have you looked into partnering like with a grocery store and maybe they could do like a healthy food demo?
Oh, that's a good idea.
I know people love food and things are more well attended when you kind of dangle that, but
Yeah,
putting it into motion with maybe like a healthy sample or something.
yeah, that's a cute idea. All right, welcome to all other ideas, so feel free to email me if something comes into your mind.
Police department?
We do have them on there. PD and fire. We're hoping fire will. We'll see. They don't know this yet, but we might ask them if they can do a fire hose spray,
Oh, okay.
because they'll be in their backyard. But it also will be May 20th, so that might be cold.
Yeah, cold,
So
yeah.
we'll see how that goes. But we do also hope that the fire department can deliver CPR, some kind of really brief educational training. That is an expectation that we'll ask all the organizations when we invite them, that they have some kind of interactive component to their table, so that it's fun and then family friendly, so no matter what age, like people can get involved in something that they're offering.
Well, I know the police were doing that wellness for ladies or women, protective.
Yes,
Okay,
many
so
of the Franklin Health Department staff went last Saturday.
Okay, so I mean, that's a bit, they're
Yeah.
talking about
And
that
what
too.
did they do?
How to protect themselves, what to look for, and then if there is something able to defend themselves. But it was, the police department is already there. Plus the fire department's doing the CPR and the Luke demonstrations. So.
Yeah.
In the past, I know they've had demonstrations.
Was that free that the police department offered that?
Mhm.
Oh, okay.
Yeah, on Saturday.
And fire department, they have the fire hose too, right?
The fire what?
The fire hose.
Yeah, when
Oh,
the
I
burning
don't
house.
know if they
Or the
do. They
burning
still
house?
have that.
They have one that
Do
you
they?
can walk through. Yeah, they bring it to sites once in a while.
Oh, they is a
The,
big
the
group.
fire department
Yeah.
brings it.
There's also a wake up call room, which Oak Creek and Greendale both have, but we'll have to see what their current room looks like, the evidence base where it currently lies, if a staff would be trained, and then if we think it's an appropriate venue. So it would be I think it's a little mobile unit that parents can walk through, or adult residents, to learn how many drugs typically are concealed, like in an unknowing way. So there's a lot of table, but I like all of these suggestions, and I think that'll be
Yeah,
a
I
nice
think the
add.
firehouse thing is always well received.
Yeah.
And the K9.
Canine, yeah.
True.
that's
I
always
saw
good
that
for
he or she, I think he won the pie eating contest this last week
The
at
canine?
one of the
The
elementary
dog
school
one?
carnivals. Pie eating contest this last week
The
at
canine?
one of the
The
elementary
dog
school
one?
carnivals.
Okay.
Yep.
Great.
Wow.
Okay.
Did he throw up after?
I do not know the details.
Dogs can have whipped cream, but I'm not sure.
Maybe it was a special doggy pie.
I bet it was, yeah.
Okay. And we'll
Thing that it's not wellness, but it is wellness. That all the seniors and the scams that are going on with the phone and
Oh,
it's just-
yeah.
that is a major.
a speaker on that would be,
Although I almost wonder if that'd be a great topic for one of the lunches.
And PD does do
Yeah. Yeah.
us like scam talk there, but good
Maybe
idea.
But it's not just for seniors.
Materials on that
Even-
at the police table so they could be handed out. 'Cause, I mean, it's not affecting wellness.
It affects
it's
families.
affecting
You know,
mental
that-
Oh, it is,
wellness.
it does.
The people who perpetuate those scams, I actually got one of those calls once. It was very real. It took me a long time
To
on the
sort of-
phone to figure out that it was a scam, you know?
Well, it's becoming so prevalent
Yeah.
nowadays that it's, I mean, I'm hearing about it more and more.
Alderman Barber, do you think that alder people would encourage their constituents to come, or how can we make that relationship stronger between us delivering information
I mean,
through alder people?
I definitely would, and I think, depending on what the council looks like on that day, you know,
Would that
that's coming up
be-
as a vote too, so we've got a turnover of 3 people. we've got a turnover of 3 people.
Do you guys typically, as council members, email your constituents things? So
We all, I don't know if we all do, but I have a constituent base.
Mm-hmm.
If people contact me, I put them on my distribution.
great.
So it's like probably 300 people in my district that I think you get.
I
some
get
of
it.
Yeah.
Oh, absolutely.
I do. Well, I
sounds great.
try to exclude.
All right, thank you. We can move on to the next item.
The bike rodeo?
Yes, we have our Franklin Bike Rodeo coming up on June 3rd. So it is annual, it's traditional on June 3rd. So it is annual, it's traditionally in the beginning of June, and we're excited to have it again this year. Also excitingly, other communities have looked to us to talk to us about how we do our bike rodeo, to either bring it to their community or improve upon theirs. So that's really a great legend here. So I believe Ascension is already committed as a donor. Don't quote me on that, but I'm almost positive. And one other organization. We have an internal planning meeting soon in that regard. But they look for sponsors to ensure that individuals can attend. To cover T-shirts and to do bike helmets is the main sponsorship opportunity, and then they look for smaller donations for things like the food for the volunteers, because we need 60 plus volunteers. So it's a huge lift of volunteers because of all the different stations that we have. So I'm sure that you'll see correspondence coming out in that regard very soon. But Amy and Kim are 2 of our public health staff that spearhead that program. So they've been putting out that like requests for sponsorship and requests for volunteers already.
Do you tap the 3 Lions clubs?
There's
That's a
3
good
lines.
question.
There's an evening Lions Club, there's the Lioness Club,
Oh.
and then there is the noon Lions Club. So
Huh.
there's 3
Oh,
different
okay, I
Lions.
didn't realize we had 3.
I know some of them are involved, but to tap.
We had 3.
I know some of them are involved, but to tap, to say we need volunteers, you know, would be
Yeah.
I'm thinking more would come forward, but I know Dirk is involved with, you know, that whole process for the rodeo.
Yeah, I'll make sure that it's on top of mind if it's not already, that that's an option.
Our community health program would be the Light and Unite Red Week.
Yes, we talked about it very briefly at the beginning of this get together, but Light United Red Week.
No, that's what that sign is.
Yes. Is next week, the 20th
If you're getting cold,
through the
we'll turn it on.
26th. It's a very warm sign.
If you're getting cold,
Through the
we'll turn it on.
26th. It's a very warm sign. Thank you to our maintenance here. Bob
Some
created
people
it.
call it a fireplace.
Some may.
Maybe the fire department should investigate it.
It sits unplugged here in the health wing, but that is a week that recognized here in Franklin, and the mayor traditionally does a proclamation, which he did at the last council meeting on the 7th, to bring a spotlight to the dangers of substance misuse and the importance of preventing it and supporting youth in positive choices locally.
What week is that again?
That is next week, the 20th through the 26th. We work with substance misuse prevention partners across the entire county. So they do things such as lighting up the Marquette Interchange and the Home Bridge, host different events in our own communities, and we've constantly tried to figure out what's the best way to get people involved here in Franklin, and then what's the most visible thing that we can do to bring attention to substance misuse prevention, because Volition Franklin Youth are doing amazing things, and we want to show support for individuals who live here and come here that are living substance-free lives or encouraging positive peer influence So this year, the coalition has come up with, well, for the second time, they launched it as a pilot last year, where we reached out to business organizations to see who wanted to be a pinwheel out in the yard of the Franklin Public Library that supports substance prevention locally. So the thought is that we could have hundreds of pinwheels all on display along Loomis, and then when anyone drives by, there's a huge banner that explains what it is.
How many did they have last year? How many pinwheels?
Probably 4 40.
Oh, I thought it was more than that. What did they have last year? How many pinwheels?
Probably 40.
Oh, I thought it was more than that.
Well, we're always looking to grow, so we're also encouraging partners or these organizations who commit or want to be a pinwheel to then push it off to other people, because it really takes a full community to show that kind
The other night, and the Volition Youth were there.
Oh,
So
really?
And then one of the Volition Youth read the proclamation as part of the meeting format, which was, fun, so.
Nice.
Pictures.
Yes, it was fun. Yes, one of our Volition Youth, Charlie, who
Yeah.
read it last year, all the way there, and it was
and he did
probably
it.
the highlight of his year, and he's
He
waiting
does
to
it.
become a
It's-
council
it's his-
member.
It's his second year now that he's.
The way that businesses and organizations can express interest is the coalition coordinator, Megan, has sent out a survey to the membership and partners, has the project director for the Drug Free Community Grant, Ellen. But I also would love to bring it to the Board of Health to see if you guys would like to support a pinwheel to show, or to sponsor a pinwheel to show your support. And if you think appropriate, perhaps we could vote to see if the group wants to collectively do that or not.
I don't have a problem with that.
Yeah, that'd be great.
I agree.
Okay.
Okay, now does that mean one of us has to stand out there as a pinwheel?
No.
You just go,
Volition Franklin will place the pinwheels, and then they'll be up for the whole week. So I will deliver that.
Okay.
Well, what do we have to do?
Say that you
We
would
just
like
did.
to support it.
Oh.
that you're gonna support.
I don't think we need a
So we
motion on
don't-
that, I just need a verbal
We don't
commitment.
financially
No,
support it.
you don't.
No.
It's just that you're standing
You're
behind
supporting a
the need for
community effort.
prevention.
Yeah, no, that's
what we
great.
need to do.
Okay.
As the Board of
You're gonna be
Health.
standing out there, we voting on
Yeah,
that?
and holding a pinwheel.
Yeah.
Board of
You're gonna be
Health.
standing out there, we voting on
Yeah,
that?
and holding a pinwheel.
Yeah.
Yes. 1 second. I'm just gonna write that you guys are. And then when people have a brick and mortar business, they get a printable sign that says how you can be a partner in prevention. So where be a positive role model in your community.
Is
have
this
this
where you put a
pinwheel
red light
display.
in your,
You can
Right.
do that. That's how it originally started.
Right.
So I will send that email to all of you so that you know what that poster looks like. But thank you all for your
If you need
support.
a red light bulb, I think there was a couple extras, weren't there?
I'm sure Megan can find one in the depths of.
It's in
Yeah,
there for
I
the
think we
week.
have some from Christmas.
Yeah, perfect. Great. And the tree outside of City Hall will be lit up red for that week as well.
Nice.
All right.
okay, and then finally, under Health Department, general updates would be the emergency preparedness.
Yes. So last meeting I talked about how we're in planning for in full swing for RNC planning. We'll continue to be in that status until next July. So I have no major updates in that front except that Health Department staff on Wednesday will be attending our regional tabletop exercise on a radiological incident. So if there were to be some kind of situation with radiation, how we would respond to that. So it's multidisciplinary, and then public health will have a seat at the table. So that will be this coming Wednesday.
Okay. And then finally, environmental health updates.
I do not have any environmental health updates. So our sanitarian inspections of our lessons establishments, and I don't have anything major to report.
Wasn't there an establishment on Highway 100 that,
The sushi place?
They were under a control plan, so our sanitarians actively work with that then to make sure that people are in compliance.
Has that-
Actively work with that then to make sure that people are in compliance.
has that been,
We haven't had any updated complaints since then,
okay,
so that is in
Good.
place.
There's still always a lot of cars there.
yeah.
I still would not recommend it.
Well, a lot of these establishments will just sell it to, you think that somebody else bought it, but it's still in the family, and it's just, yeah, under another name.
Crunchy sushi.
Yeah.
Does anyone else have
Hey,
anything?
protein. Any other comments? If not,
So move.
Second.
and any discussion? Hearing none, we are adjourned.